There are many reasons behind the lack of local beds and services for mental health patients, such as funding cuts, staff shortages, increased demand, and COVID. Let's explore each of these factors in more detail. First, funding cuts. According to a report by the Treatment Advocacy Center, a nonprofit working to improve treatment for severe mental illness, the U.S. now has 37,679 state psychiatric beds, down about 13%, since this means that there are fewer places for patients who need intensive and specialized care for their mental health conditions. The report also found that the nation needs an additional 123,300 psychiatric hospital beds to meet the demand. However, funding for mental health services has not kept up with the need. In fact, many states have reduced their spending on mental health in recent years, leaving gaps in community-based services that could prevent hospitalizations or help patients transition back to their homes after discharge. Second, staff shortages. Even when there are beds available, there may not be enough qualified staff to provide adequate care for patients. There is a shortage of psychiatrists and nurses in many areas, especially in rural and underserved communities. This makes it harder for patients to access timely and appropriate treatment and puts more pressure on the existing workforce. Staff shortages also affect the quality and safety of care, as staff may be overworked, burned out, or unable to provide individualized attention to patients. Third, increased demand. The pandemic has worsened the mental health crisis in the country, as more people are experiencing stress, anxiety, depression, isolation, and trauma due to COVID-19 and its impacts. According to a survey by the Royal College of Psychiatrists in December 2020, 85% of psychiatrists said there was more pressure on beds compared to the same time last year. The survey also found that 92% of psychiatrists estimated there were less than 5% of beds available in their trust. The college recommends that 15% of beds should be vacant at any one time to manage admissions and discharges effectively. The increased demand for mental health services also reflects the high levels of unmet need in the community, which has grown during the pandemic due to lack of access to preventive and supportive services. Fourth, COVID, the virus itself, has also affected the availability and delivery of mental health services. Some beds have been closed or converted to accommodate COVID-19 patients or to prevent outbreaks among staff and patients. Infection prevention and control measures have also made it more difficult to provide group therapy, family visits, or other social activities that are beneficial for patients' recovery. Moreover, COVID-19 has increased the risk of infection and complications for patients with mental health problems, who may have underlying medical conditions or face barriers to accessing health care. These are some of the reasons behind the lack of local beds and services for mental health patients. This situation has serious consequences for patients' well-being and human rights, as well as for public health and safety. Patients who cannot get a bed may end up in emergency rooms, jails, or on the streets, where they may not receive adequate care or may harm themselves or others. Patients who are sent out of their local area for treatment may face poorer outcomes and longer stays due to disruption of their social support networks and continuity of care. Patients who are held in inappropriate settings such as regular hospitals or jails may experience further deterioration of their mental health or violation of their dignity due to lack of privacy, security, or specialized services. Therefore, it is urgent and necessary to address this problem by increasing funding for mental health services at all levels of care, expanding the workforce and training of mental health professionals, enhancing crisis intervention and prevention programs, and ensuring that COVID-19 does not compromise the quality and safety of mental health care.